Back. Is the public campaign against health policies in the United States important for the rest of the world? I'm talking about the massive Roe versus Wade controversy playing out in the United States this week. Opponents and supporters of abortion rights have been, in some areas, clashing in protests after a draft ruling by the Supreme Court, we're told, was leaked. That draft has now been confirmed to be authentic. It deals with whether women should be allowed the right to abort. We can talk about this and possible implications then for South Africa. We're joined by a researcher on the issue, health researcher Pontsho Pilane, joining us today from Johannesburg. Pontsho, good to have you on as always. Let's talk about why in the South African context what's happening in the US is so important to watch right now.
Thank you so much, Tembekile. It's so important because we already know that there is a long history of looking at United States Christian right-wing organizations and nonprofits funneling money into South Africa and other African countries for anti-abortion work and homophobic work as well. And by that I mean that we've seen that there's traces of money that has come into South Africa where work to usurp our abortion rights in South Africa has happened. There is an NGO already in South Africa that receives money from international Christian organizations that are known to be anti-abortion. One of them is called the Heartbeat International Organization, one of the biggest anti-abortion organizations in the US, has sent money to NGOs in South Africa for what is called abortion or pregnancy counseling. This is basically anti-abortion counseling that where somebody who's pregnant who might find themselves in crisis because they're pregnant unintentionally, where they go in the guise that they're going to receive advice about their options, whereas they're being coerced into not getting an abortion and therefore keeping their pregnancy. And I know this, Tembekile, because in 2018 I went undercover at one such pregnancy crisis center in Pretoria, where I pretended to be a pregnant person who wanted an abortion. And in many ways, the person that was helping me, who was the director of that NGO and crisis center, tried to convince me to keep the pregnancy.
And that has been what's also come out of the protests in the United States after the leaking of that draft outcome from the Supreme Court. We know the final ruling will be delivered in a matter of weeks from now, that abortions aren't necessarily going to stop. What's going to happen is we're likely to see if indeed the 1973 ruling is undone, many more American women would then go have abortions illegally, and which would be dangerous, no?
Yes. In the pro-abortion advocacy circles, we say that there is no such thing as an illegal abortion. There is such a thing as an unsafe abortion. And if you look at data across the world from different parts of the world, in the US, here in South Africa, and any other parts, where it shows that when there are progressive abortion laws that allow for abortions to happen, that illegal or unsafe abortions go down, maternal mortality rates decrease, and that's what we want. We want the safety of people who can get pregnant, or people with uteruses, women, non-gender conforming people, trans men, to be able to access their sexual reproductive health services and rights, because they should be able to do whatever we should be able to do whatever we want with our bodies. But what Roe versus Wade poses, it's also, in a lot of circles as well, a lot of activists have come out saying that they were expecting this and they have been preparing for this. If we look at the past 10 years, particularly looking at the Trump administration that extended what we call the global gag rule, which is the Mexico City policy that allows for U.S. money not to be used for anything regarding abortion, and that U.S. money that is funneled into, that funds NGOs in places like South Africa and the continent for sexual reproductive or global public health services. When Donald Trump came into office, he extended that policy to say that organizations that receive U.S. funding are not even allowed to promote abortion. That meant that during the Trump presidency years, an NGO that received U.S. funding was not even allowed to refer person who's pregnant, who's looking for an abortion, to a place of abortion because they risked the fact that they would lose funding. And so what we saw, yes, sorry.
Just on that, Pontsho, the point that you're making about how this could have funding implications, right, for people who work in this space, this reproductive space in South Africa, where would they be able to look, I wonder, almost immediately if that were to happen, for funding?
So like I was explaining with the global gag rule, right, where USAID and US government funds a lot of global public health programs across the world and even here in South Africa. A research that was done during the Trump years showed that there was a lot of NGOs that provide services, and this is not just abortion services, it's youth NGOs that provide youth services, HIV treatment, contraceptives, and other healthcare needs, not just sexual reproductive needs, lost funding because they just couldn't not promote abortion, or when they accepted, it means that they had to let go of any promotion, referrals of abortion. What this has done in South Africa and in many other parts of the world, particularly in Africa and other global South countries, is that it has disintegrated public health services, right? The move to global public health is one of where we talk about integrated services. This is kind of curating one-stop shops for public health services. So, for example, as a woman, if I go into a certain health facility, I should be able to get my primary healthcare needs, get my contraceptives, and if I'm HIV positive, get my treatment as well. But the global gag rule created an environment where this was not possible. And it also created, so we found, the research shows that we saw that people who needed sexual reproductive health services were not accessing them anymore simply because of this rule. So it's not that the judgment, the Roe versus Wade judgment or the Supreme Court decision we're waiting on could impact us in terms of just that our law will change. But it's about the global public health funding mechanism and also the influence that U.S. right-wing Christian lobby groups have in the country.
Pontsho, always so good to speak to you about these issues. Thank you very much for your time.
Thank you so much.